nice. I spent some time in Ohio. It was good times growing up. And then I lived in Chicago.
Chicago's business. I never went there. Great city. I had fun in business.
Good evening, good evening. Thank you for joining us this evening. Tonight we have something a little different. Sorry about that. Again, we welcome you, those on social media that's joining us tonight. We're going to begin with a prayer. Let us pray. Heavenly Father, we thank you for this day, a day unlike yesterday, a day unlike tomorrow, where it's truly a present, Heavenly Father, to wake up with a sound mind, a sound body, a roof over our head, food's on our table, and a job, if you're lucky enough to have a job, Heavenly Father. Heavenly Father, we want to ask for blessings for our senior minister and his wife, Heavenly Father. Continue to impart wisdom upon his head so that he may share it with your followers, Heavenly Father, and one day we all can hear, well done, thy good and faithful servant. Heavenly Father, we also come to you with a special prayer for our leaders in this country and throughout the world, Heavenly Father, as the focus shifts to how we can return to some normalcy. We hope that the ultimate decision is human lives, Heavenly Father. Heavenly Father, we ask for these blessings and many more. In Jesus' name we pray, amen. All right, tonight we have something different. Tonight we have something different. Those that attend Fifth Avenue regularly know that every now and then we have a community informational event. And tonight is one of those nights. We have with us from the senior dedicated senior medical. We have with us Dr. Ajoy Kimura and Mr. Greg Lindstrom. Dr. Ajoy Kimura is going to talk to us about the coronavirus effect and effect on those with higher risk. And Mr. Greg Lindstrom is going to follow him and talk to us about the services that the dedicated senior medical center can provide. Thank you. Dr. Kimura.
Thank you, Mr. Wilson. Thank you, Mr. Wilson. Thank you, Mr. Wilson. Really appreciate the opportunity, as well as from Pastor Tucker here to come and present on a very important topic for all of us, actually, which is exactly what Mr. Wilson talked about, is coronavirus effect and effect on those with higher risk. Now, as we go through this process of discussing I wanted like to make it a little bit interactive on certain slides. I'm going to stop and ask if anybody has any questions, whether here in person or online. And just to let everybody know, everybody's spaced out appropriately here, and everybody's wearing the appropriate things too. So we'll go ahead and get started. All right, so in this presentation, we're going to do a brief introduction of what the coronavirus is about, give you some basic statistics on it. I'm going to talk to you what SARS coronavirus 2 is, and that's the second little slide right over here that you can see. And then how do you catch it, and then how long does it last on surfaces? What happens when I catch it? How do I treat it? Is there a vaccine? Can you be immune to it? And what can I do to help my family and my community? From a worldwide perspective, some basic statistics here, as you can see. There are roughly 2.5 million cases, confirmed cases of coronavirus, and 176,926 deaths from it. In the United States, 824,698 confirmed cases with over 45,000 deaths, and that's increasing. In Florida, we have 29,495 cases and growing, and 839 deaths. Pinellas County, 591 cases and 16 deaths. Now you sit there and think, well gee, you go from 2.5 million worldwide cases to 591 cases, and from 176,000 deaths down to about 16,000, we're doing pretty good. Yes, unless you're that one person of the 16 and the family that goes behind that. Every number that you see there in the death is a person who has a mother, father, brother, sister, grandparents, or young children that have been left behind. So let's keep that in mind too, as when we talk about fatalities. Now, not many of you can see this here, but I'm sure they're going to project it on the screens, and you'll see it online as well too when you're able to download this. But this is from the New York Times. What I'm going to show you here and what they're going to pull up is a website from the New York Times that takes a look at all the cases in the United States right now. So if you take a look right here, and when you finally get to that point where you're on that website, oops. Go ahead and cancel out of that, please. Yeah, thank you. I'm pressing the wrong buttons. So if you take a look, up in the New York area, 95,000 cases right up there. The darker in the red, the more intense the level of cases are. And as you're going over those areas there, it gives you an automatic total of cases and the amount of deaths in those areas. This map here can actually drill down to how many cases to the neighborhood, which is really pretty impressive. And that's something that I wanted to share with you guys here, just to let you know, it's not all about New York. You see cases in Los Angeles, you see it in Colorado, you see it heavily in Louisiana, Mississippi, Chicago, Michigan. It's all over the United States where there's large populations, okay? And large inner city populations at the same time too. Can you hop back to the slides? Thank you. Perfect. So why do I bring this slide up here? This was recently done in the Journal of the American Medical Association. There was a discussion that talked about COVID-19 in the African American population. African Americans are significantly impacted by COVID-19 for a variety of reasons. A lot of it has to do with economics and what we call the social determinants of health. And it's really important that we talk about these things and acknowledge it, bring it to light and discuss it. I have a colleague of mine, Dr. Shay Blackstock, who does this on the national level, and she's talked numerous times to multiple news groups about the impact of COVID-19 on African Americans. It is very disproportionate, which is why I'm so thankful that we're talking to each and every one of you here today. What does this say here? When you take a look at it, it says what's currently known about these differences in disease risk and fatality risk. In Chicago, more than 50% of the COVID-19 cases and nearly 70% of the COVID-19 deaths involve black individuals, although blacks only make up 30% of the population. That is a significant amount. Moreover, these deaths were concentrated mostly in just 5 neighborhoods on the city's south side. In Louisiana, 70.5% of deaths have occurred among the black persons, who represent 32% of the state's population. In Michigan, 33% of the COVID-19 cases and 40% of deaths have occurred among black individuals, who represent 14% of the population. In New York City has become the epicenter. This disproportionate burden is validated again in underrepresented minorities, especially blacks and now Hispanics, who accounted for 28 and 34% of the deaths, respectively. So you can clearly see here that the minority populations are getting hit the worst in this. Okay? And we'll talk a little bit further about what aspects. The next slide here looks at a county majority breakdowns, and this is from the Johns Hopkins University American Community Survey. And the data was based on 100,000 averages of where people are, where they're located. And what's striking about this is, if you can see this here, deaths per 100,000. The African American population is well above the Asian population, the Hispanic population, and the white population. Okay? That can help drill it down a little bit more to everybody here, and why it's important for you, number one, to understand what COVID is, and number two, to take precautions, and number three, to take care of each other without being a victim of the virus. It's really important to understand those things. This next slide here, what does it talk about? Again, the deaths and the percent population. And if you can see here, all the data on the blue is where the percent population is in terms of African Americans in all these states. When you go all the way out to the light blue area, that's the percent of deaths. So you're starting to see a higher population of death counts in each state, and the majority of the folks that are dying from this are African Americans, people of color, people of minority status. Another interesting thing is, when you talk about deaths, well, what age groups are we talking about? This is the famous study that came from Wuhan, China, right? Where they ended up doing there is they took a look at all the deaths, and they found out 14.8% of the deaths that occurred in Wuhan occurred with the age categories of 80 on up. 8% ages 70 to 89. But if you could lump all these things together, you'll see a huge proportion of deaths occurring with individuals over the age 50. Now, that doesn't mean that a young person can't die from it. We've seen stories, and there are many coming, of infants dying, of people in their 20s and 30s dying from it. What's a common theme within all these things? Each and every one of those individuals had some background illness going on. Hypertension is one of the biggest things. Diabetes is another big thing. Chronic kidney disease is another thing. And we know these diseases are rampant within multiple populations, but more so in the African American and Latino populations as well. So if you have these conditions, you're at more risk, if you're a certain age category, of contracting COVID. And it's really important that you understand that, and you take the necessary steps to not go out into public, protect yourself, wash your hands, everything that we'll talk about, so that you don't get COVID, whether you're outside or at home too. So what is SARS-CoV? Because we call it SARS-CoV, otherwise known as the coronavirus. And why is it called the coronavirus? Well, let's talk about how names come up in the first place. It's called the International Committee of Taxonomy of Viruses. Viruses are named based on their genetic structure to facilitate the development of diagnostic tests, vaccines, and medicines. The name was chosen because the virus genetically related to the coronavirus responsible for the SARS outbreak in 2003. Hence, SARS-CoV. So what does SARS-CoV stand for? SARS, Severe Acute Respiratory Syndrome Coronavirus 2. Okay? The title itself tells you that it is a severe illness that affects your lungs, your respiratory system, and is done by the coronavirus. and this is the second version of the coronavirus per se. The name COVID-19 comes from the fact that SARS-CoV causes coronavirus disease. That's what COVID stands for, 2019. So SARS-CoV-2 causes coronavirus disease from the year 2019. Why do they call it the coronavirus? If you take a look at this picture on the right, that is the virus right there. You see all these little red things on there? It looks like a crown. Hence the name corona for crown virus. Okay? Now, I put this slide up here because I wanted you to see the background video of it. And what's really interesting is that when we talk about social distancing, the 3 to 6 feet, mostly 6 feet, is because when somebody exhales from a sneeze, that sneeze goes out about 100 feet per second, and the gases emitted from it, or cough or sneeze or exhalation, can travel 6 feet very quickly and can travel up to 20-some feet. We can go back to that video. I don't know what happened there. Nope. It's okay if we can't get it. The point being made is that there's a high, and you can see this on the Facebook download that you guys will soon see. Just click on the picture right there, and what you'll see is a slow motion video that's taken at 2,000 frames per second, which shows somebody sneezing and the cloud of debris and droplets that spread out over not just a few feet, but well over 6 feet. So just because you don't see it doesn't necessarily mean it's not there. You're walking right in the pathway of a virtual explosion when somebody sneezes. Now, whether that person is adult or a child, they can be an asymptomatic carrier. And what that means is that person does not have actual disease, but they may be carrying the actual virus. So when they sneeze, that dispersion that you see and you walk through, that droplet will hit you, and what you will do, you won't even notice it's happening. You'll go walking around, the virus grows, and what happens is the virus is on your hand. And how often do we touch our faces? How many times did I touch my face already? About 2 or 3 times. So they actually did a study and said, how often do people touch faces? In small groups, they found out it's between 15 and 17 times that you touch your face. In larger groups, it's about 4 times an hour versus 15 times an hour. So the portals of entry for coronavirus are the nose, the mouth, primarily. And those are the areas that most people touch on their face quite a bit. So when you walk through a cloud within a 3 to 6 foot radius of a person that sneezes, those small droplets attach to you, you touch yourself, you then take that virus, and you plant it on your face, plant it in your nose, plant it in your mouth. That's why it's really important, and that's why all the people say, don't touch your face. But it's so hard not to do because we do it so many times for a variety of reasons that we leave ourselves open for catching coronavirus. Goes to this slide right here. The virus can survive on surfaces for long periods of time. In fact, when they did the study here, they said that as an aerosol, when you sneeze out in the open, that virus can linger up to about 3 hours in the space, in the air. On copper, up to 4 hours. On cardboard, up to 24 hours. On plastic, 2 to 3 days. On stainless steel, 2 to 3 days. That's why it's so important when we sit there and say you touch surfaces, whether it's the podium that I'm having, or your cell phone, or your remote control, or a car door, or a doorknob. There are people that probably have it, carrying it asymptomatically, that are transmitted to the surface, and now you picked it up. So we're touching things all the time. So the question comes, well, what about wearing gloves? I've seen a lot of folks wear gloves recently, and quite frankly, what does it really do? Nothing. Because what do they do when they touch things with their gloves? They go back and touch their face with the gloves. The other day I was at the gas station just sitting there watching this happen, and the individual literally took out a hand wipe with his gloves, wiped down everything, touched the, for the gas pump, pulled the gas pump out, put it back into his car, and then wiped his head with the same glove. So it can happen just like that, very subconsciously. But just be aware these things are on surfaces, and that's why it's important for you to wash your hands. It's hard not to touch your face, especially when you're wearing a face mask like this right here, because it gets quite itchy underneath. But you got to make sure that you continue to wash your hands. So how infective is this? The next slide really talks to this. You see what up there is called a R0, or it's called an R0 number. That is how infective an actual virus can be. The R0 means if I have one person that has that and transmits it to one person, the R0 is 1 at that point in time. Okay? So what you have to do is then calculate it out. These are calculations done by epidemiologists. And here are the R0s for the flu virus versus COVID-19. So if one person with the flu, they could pass it to 1.3 people with the flu. But if you have COVID-19, one person can pass it to 2.5 people. That's how effective it is. Okay? So it's not just a matter of, hey, I'm doing good by myself. No, all you have to do is touch something, sneeze and whatnot. Next thing you know, you've infected 2 to 3 people, and those people infect 2 to 3 people, so it just keeps on growing and growing and growing. Well, what's the incubation time? With the flu, it's about 1 to 4 days. With coronavirus, it's 1 to 14 days. So you may not feel anything at all for a solid 10 days while you're busy passing this virus out to everybody, or catching it from somebody else. Hospitalization rate, the average percentage for total cases in the flu is about 2%, right? And then for coronavirus, it's 19%. It's not even triple. It's not even quadruple. It's many more times over the amount of 2% that you get for flu. So it's a much more infective virus. And when we talk about case fatality rate, what is the percentage of reported deaths among total cases? The flu is 0.1% or less, whereas coronavirus is 1 to 3.4%. So not only is it much more infective, it spreads faster, you won't notice that you have it, you have a higher rate of getting hospitalized. On top of that, if you're in the right population with the right diseases, you have a higher rate of dying from it. This next slide I want to make sure I talk about before they push the button to show a video here. But I would like for you guys who are on Facebook and whatnot, download this thing, take a good look at this particular slide. And I'm going to kind of go through it from the upper right-hand side all the way to the bottom here, because this is how SARS-CoV works. When it gets into your lungs, it doesn't stay at the top of your lungs. It goes all the way to the outside of your lungs, right? What we call the periphery of the lungs. In that area there, it causes a lot of inflammation in this area here. So what happens when you have inflammation? Inflammation produces lots of water, right? And so when you start producing lots of water, you can have a viral infection, and then you can have a bacterial infection on top of that too. So a lot of folks, the virus grows in this area here, continues to grow. You really don't feel it that much when you first get it, and then you got that 1 to 14 day incubation period, 2 to 14 day incubation period, where it sits there and just grows and grows and grows until it starts creating lots and lots of infection in this area here where it becomes moderate. So that's when your lungs start filling up with fluid. And when your lungs have fluid and not air in it, it's hard to breathe. And then when your lungs completely fill up with fluid, you cannot breathe at all. Hence the name acute severe respiratory distress. Okay, so it's really important that you understand the process, that this is not something that, hey, you just get it from a sneeze. It goes down deep into your lungs, and causes all sorts of havoc. And when you have lots of fluid and mucus and buildup and all sorts of debris from bacteria, you end up with a condition what's called sepsis. And sepsis, it's when you have complete inflammation, infection spreading all over your body. You have anywhere between a 50 to about 80% chance of dying at that point in time. Okay? And if you have diseases that lower your immune system already, the higher the risk of dying at that point in time. That's why a lot of these cases are managed in the ICU setting. If you guys want to go ahead and roll the video in the back, I want to show you something here in regards to this. So this is a neat little video that I came across on CNN, in which it took a picture of a lung, and it showed the growth of the COVID in the lung. All right, so these pictures right here show a nice clear lung, and then eventually you see all these yellow deposits on the outside of the lung. That's the coronavirus growing in an actual person. So this video takes us all the way around. They use this kind of scanning prior to doing lung surgeries, by the way. So this is how the coronavirus spreads. It goes to the outer part. Now you notice here, almost about half of the lung is already taken in this individual with coronavirus. And it's taken all the way around the outside. So there's no other way to breathe for this individual other than through the ventilator. And what's interesting about this is it's mostly located in the sides and the back. So most people, when they're in the ICU, and you can turn the video off, thank you. And most people, when they're in the ICU, you're on your back with the tube. But if the virus is sitting all the way in the back and the sides, you're not going to get much air coming down there to help you breathe. So what they've started doing now is they flip people on their stomach. It's called the prone position. And that's been known to help people out in the ICUs to get better air functioning through that area there. And that's very akin to what we call high altitude pulmonary edema. So when you go up high, to a high altitude, your lungs fill up with fluid because you haven't gotten acclimatized. And that's the same kind of thing we're starting to see in SARS coronavirus here. And that's why a lot of the treatment have to do with putting a tube in you to help you breathe. And number two, flipping you on your belly side down so you can get that air through so you can start breathing. Because without that oxygen, you're not going to survive. And without the medications, you're not going to survive. And again, going back to the aspect of hypertension, diabetes, chronic kidney disease, and then you have something like this, the higher the rate of mortality, which is death, and an individual in populations that have this. Does anybody have any questions, whether here or online? We're waiting because there's a delay in communication from about 90 seconds from what people type to getting it here, so give it a second. 90 seconds. Okay, so no questions to date or to this minute, so we'll continue. Go to the next slide. So this slide here talks about how it affects the body. And in this slide right here, you see the mild, severe, and critical. Again, SARS affects the lungs. SARS-CoV, COVID-19, the disease affects the lungs. So in the mild cases, most cases, coronavirus infection are mild and resemble the flu, right? And the fact that it happened near the end of the flu season, start of the allergy season, didn't help out much with anything either. It's hard to discern a lot of these things. Then it becomes serious. The inflammation causes fluid to accumulate in the lungs, and the immune system fights the viral infection. But if your immune system is already slowed down because of the disease states that you may end up having, it's hard to fight off a very serious infection that's very infective. The fluid in the lungs makes breathing difficult. Blood oxygen levels fall. When your blood oxygen levels fall, your heart beats faster to try to compensate. At some point in time, you won't be able to compensate, and you'll throw a bad heart rhythm that could kill you at that point in time. All right, so this is the physiology of the body, it's how it works. And last but not least, the critical aspect. The immune system becomes very overwhelmed by the viral infection and leads to sepsis, which is basically a bacterial infection on top of a viral infection. And sepsis can kill 50 to 80% of folks once you get it. And that's very, very obviously very bad for not only the individual but also the family members. So how do you treat it? Most of these cases, they have to be isolated. Makes sense, right? Because a person, if they're having trouble breathing, what are they doing at the same time when they're having trouble breathing? They're taking deep breath in and coughing to breathe. But when they cough, if you remember, that 6-foot radius, that spread of the aerosol of that cough can cover 6 feet in less than a second. And it can spread all the way up to 25 feet too, which is why we recommend anybody that has any kind of fever symptoms or any kind of coughing to wear a mask. Why? Because when you sneeze and cough into a mask, you sneeze and cough into a mask and you don't shoot that plume of droplets out towards everybody. What's the next thing that you do? You get admitted to the hospital because this cannot be treated in a clinic. This cannot be treated at our urgent care. When you go to the hospital, it's not treated in the general population in the hospital. They'll isolate you among everybody else. So the COVID patients have their own wing. They have their own areas in the ICUs. And a lot of hospitals are doing this because you don't want to mix the COVID positive patients with the patients that are not COVID positive and then further spreading the disease. So you separate individuals. The next thing that you do is you treat them. Well, what are we treating with? We really don't know. We really don't know what works. We're literally building the airplane as we're flying it at this point in time. Right? So everything that we're learning for countries that have had COVID a few weeks to a few months ahead of us. And we're trying to play catch up. So there's medications such as hydroxychloroquine. Chloroquine, azithromycin, and remdesivir, which is an antiviral that we're looking at in clinical trials. Questions, please.
The question was asked, does wearing a mask make a difference? And also, do we have to wear a mask everywhere?
Answer is yes, it makes a difference, and yes, wear it everywhere. And the reason why is when you sneeze or somebody else sneezes, you're walking through that plume of water droplets. You're inhaling those water droplets. You're not even knowing that you're inhaling those water droplets. A few slides back, I showed that how long it lingers in the air, up to 3 hours. Those droplets can linger in the air. And that's why folks with especially lowered immune systems should be wearing masks. Right? Should you wear it everywhere? Absolutely, you should wear it everywhere. Because where do most people go these days without masks? Everywhere. So you're protecting yourself at all times, and it's really important to do that, especially if you're in that population where you have hypertension, diabetes, chronic kidney disease, cancer, and whatnot, because it lowers your immune system and the higher likelihood of you catching things. Other questions?
Question was asked, how does the COVID-19 leave your system? And once you are treated of this virus, does it come back?
That's two great questions. So, going back to the few slides that we had, remember the portals of entry of COVID are what? You touching something, and then you touching something else that goes into you, whether in through your nose or through your mouth. And viruses, like everything else, like some warm, humid places to grow into. They invade cells, and those cells grow, produce more viruses, and they keep spreading like that. So they grow in that sense, they get into your body. So once they get into your nasal tract, they get into your throat, eventually they'll go down to your lungs. So when it starts building up in the lungs, you start feeling signs and symptoms. And those symptoms are what? I feel feverish. I feel like I'm having trouble breathing. I have a cough. It's a dry cough. I'm not coughing up anything, right? So when you cough, remember, that plume of water droplets from that cough goes 6 feet at roughly hundreds of miles an hour. I mean, it goes really, really fast. And anybody walking through that plume will get it if their mouth is open, if their nose is open to the air without wearing a mask. So that's how it spreads, through touch, through sneezing, through coughing. Does that make sense? Okay. So clinical trials. You have clinical trials for hydroxychloroquine, chloroquine. Well, what are those medications? Those are medications that we use for preventing and treating malaria. Well, how does that work? Nobody really knows. But it seems to work in certain places. In other places, it's not. In fact, there was a recent trial that was done by the VA and found over 300 some individuals that were treated by the VA and found no effect on folks. So, is hydroxychloroquine, chloroquine okay? A lot of trials are saying no, it's actually not working very well, and the reason why it's actually harmful is that these medications affect the heart. And they'll make you throw abnormal rhythms in your heart that most people, in a lot of the studies, they stopped the studies because people started having heart attacks. Next question.
Some have been told that once they get home, they should strip and leave their shoes outside. Is that really necessary?
Yes. You can certainly remember, coronavirus, when you sneeze, the water droplets go out and eventually gravity takes over and pulls you down to the ground. And it sits on the ground for how long? Hours to days. Hours to days. So what happens when you walk over that same ground that somebody sneezed and that water droplet hit the ground? It's now on the bottom of your shoes. Right? You take that and you transport it into your house and you're walking all over the house. You pick the shoe up, you take your shoe off. Where are you touching the shoe when you take your shoe off? Your hand, right? You take your shoe off, you put the shoe in a place. What do you do with that hand? Most people don't wash it. What do they do next? They go say hi, they give a big hug to somebody. That spreads onto that person's back. So if you're continuously spreading the virus. So absolutely, what I recommend, what I do too, when I go home, is these scrubs. What they end up doing is they come off in the garage, with the garage door closed, of course. And the shoes come off as well too. So I go in, the first thing I do is I wash my hands. And I wash my hands all the way up to the elbows. All right? Because my elbows are exposed too. Right? And if I'm working with the patient, and not everybody's working with the patient, I may end up going and taking a shower immediately there and then coming out. But if you're not that close to COVID patients, you don't need to go to those extremes. But for sure, what you should definitely do is not transport your shoes all over the house because you're spreading the virus there in and of itself. Go before you enter the house, or even as soon as you enter the house. Wash your hands. Wash your hands. And how long should you wash your hands? 20 to 40 seconds. Continuous scrubbing. Get through all the nooks and crannies between your fingers as well too. Underneath your nails, right? A lot of nose picking going on. So all that stuff and the debris gets underneath your nails. So make sure you clean underneath your nails. All right? People touch their eyes a lot too. So that's another area that coronavirus can spread and grow and go from there. So it's all about managing yourself before you walk in the house. When you clean your house, clean those areas that are touched more often. And what are those areas? Doorknobs, remote controls, cell phones, headphones, right? Shoes, computers, televisions, just about anything. But you don't have to take drastic steps. Now, there are folks out there that are putting hydrogen peroxide and whatnot on fruits. Please don't do things like that. All you have to do is just wash it with water. Okay, you don't need to scrub it down with bleach either. That's dangerous, especially since some of that stuff actually seeps into the fruits and vegetables. Clean it nicely and eat. What we tend to do at my house is that we tend to eat more cooked food than raw food than anything else, because that heat denatures a lot of things, from bacteria, viruses, to a whole bunch of things. So we try to eat a lot of warm meals when we go home. So take those precautions before you enter your house. Take your shoes off, right? When you walk in, wash your hands. Make sure all the kids wash their hands too. Have a little one at home. As soon as he comes inside, the first thing we do, shoes off before he gets into the house. As soon as he gets in the house, wash your hands all the way up to your elbow. And he washes it for 20, 40 seconds. And he'll sit there and sing through the whole thing as he's doing it. And you're learning how to do that. There was one day, I came home, and I went in real fast, and he stopped me. Dad, you didn't wash your hands. Go wash your hands. And I was like, good boy, you're learning, you're paying attention, bad me, right? So they pick up after you because you're the number one role model as a parent, as a child too. So what are some other treatments that we can talk about? Azithromycin remdesivir. That's a new antiviral agent that's coming out. There's some good news coming out of that, but I don't think it's going to be ready quite yet. Azithromycin, the Z-Pack, right? Everybody's got the Z-Pack. Problem is, when you mix azithromycin with hydroxychloroquine, you could actually extend a heart rate, which can lead to death. So some of these things have added things. So we don't really know at this point in time. We're doing the best we can in the ICUs. Best not to get it at all. Best not to put yourself and your family in a position to get this either. The next thing that they're looking at is convalescent plasma. What is that? So convalescent plasma is basically a blood product from a person that survived COVID. So what happens? When you get COVID, you start building up antibodies. And antibodies are the things that the body develops to protect you from the next onslaught of that virus or bacteria. So what they found out is that if we take some of those antibodies out, we transplant it to other people, they've actually gotten healthier and better at the same time too. So convalescent plasma is a big thing. That's why there's a lot of blood drives going on now, especially when it comes to COVID or COVID survivors, to donate blood so they can take the plasma out of the blood aspect and then transplant it to somebody else that's actually doing even worse. There's other medications called tocilizumab. MAB is a monoclonal antibody, and that's specifically designed against a particular virus, bacteria, what have you. And these are primarily used for rheumatic disease, rheumatoid arthritis. They're starting to do trials on that. Isovir, ritonavir, those are antiviral medications that you use for HIV treatment. They're testing those as well. Ostelnavir and the favipiravir, as well as ivermectin. Those last two right there, they treat the flu. One here, the other one in Japan. They're testing that. Ivermectin you use against parasites. So we're trying to throw virtually the kitchen sink at this thing here and see what works and what doesn't work. Questions? Okay. Keep going. So is there a vaccine? There is no vaccine right now. It takes about 1 year to 18 months to get the vaccine. How many months are we already into this? About 3 months. But shockingly enough, they did an autopsy on a person, or not shockingly enough, that predated coronavirus, the actual first death of coronavirus, and they found coronavirus in that person's lung. So what's interesting is that this virus may have been here much longer than we thought of. Why? Because how quickly emerging diseases can spread throughout the world through air travel. You can literally get from here all the way to Japan within about 15 hours. There's direct flights that do that kind of stuff. So if you catch a virus out in one of these areas and it's one of those emerging viruses, you could spread it around the world within 48 hours because of the infective rate and how many people that you infect and the lack of symptoms that you feel, everything that we talked about. So that's why it's really important to understand this. From a vaccine standpoint, we don't know yet. It takes time to develop a vaccine, and then you have to test the vaccine. If you guys can remember Ebola, how deadly that virus was, and how long it took to get a vaccine. More importantly, where are they testing the vaccine at? In those areas there. So you have to get special permission through government agencies, whether it's the FDA or even outside the United States, other agencies, to test the vaccine. Now, there is a vaccine trial going on right now within the United States. It'll probably take 6 months to get any kind of good feedback in regards to that, because what they have to do is when you give a vaccine, it creates antibodies to that virus, right? And what the antibodies do, you collect that amount of blood from somebody, you test their antibodies, you see, well, how many antibodies will prevent another infection? We don't know. That's why we check rubella titers, right? That's why we check the MMR titers. That's why we check all these other titers for those of you in healthcare. Before you start working in healthcare, we check for titers. And what does that do? It tells you how many antibodies are present that can actually help prevent an illness. In the case of COVID, we don't know how many antibodies will help prevent an illness, nor do we know how long those antibodies will last. Does that make sense? Yeah. Any questions in regards to vaccines? Okay. So, kind of what I mentioned right here, can you be immune to it? That's the next question. Well, we really don't know, because we really haven't been dealing with coronavirus long enough to sit there and say, will this antibody last for that long? And this diagram right here, you see it pretty clearly. The first time that you get a virus or you get an infection, you have all these little things that look like a Y. Those are the antibodies that come in. Those are all those things that attach to that and help protect you from a virus or bacteria. And what happens is, the first time you get it, you get a little bump right here of antibodies. The second time you get it, you may get an even bigger bump of antibodies, but we haven't even tested that aspect out yet. And when we do get that bigger bump of antibodies coming out, we don't know how long those antibodies will stay around to help keep you immune against COVID. And we don't know how long it'll stay, because what can happen is this can go up in terms of antibody dose, antibody amounts, and they could come back down quickly. We just don't have enough information yet in terms of how effective vaccines will be. So in terms of immunity, it all depends, and we don't know very well. Questions?
Question is asked. If someone at your home catches the virus, how do you protect the others?
That's a tough question. First thing you have to do is isolate that individual. But remember, when that person gets the virus, how long are they symptom-free before you realize they have the virus? 2 to 14 days. Chances are other folks already have it if they've been in contact with that individual for that long period of time and how close they are. They're face to face, sleeping next to them, all those kind of things like that. You may already have it. It doesn't mean that you'll succumb to it because you may not have risk factors that increase the likelihood of you succumbing from it, but you may already be one of those asymptomatic carriers of the virus. So if someone at home has the virus, what should you do? They should be isolated. Not locked up in a room, but isolated, right? Don't put them in a room, lock it up, not give them food and water and tell them not to come out. Don't do things like that. You kind of keep them isolated from everybody else. You get folks that are maybe having health conditions, go to somebody else's house and stay there, and you take care of that individual the best way you can. Well, how do you do that? Everything that we talked about, wash surfaces, provide them food, water, all those things that you have to do, but make sure those utensils are nicely cleaned when they're done with that, right? If they sneeze and they're using tissue, make sure you're using gloves to collect all those things and put it into a receptacle or a trash can that's specific for them, so that way you don't keep spreading these things around every place else. And that way, only one person has access to that person, so you don't have 15 people taking care of that individual, because that's 15 likelihood scenarios right there of 15 individuals getting sick by taking care of one person. Have only one person take care of them. Do shifts if you have to do that. Okay, so those are some practical things you can do. Other questions?
There's a vaccine from 2001 that's circulating social media, the novel coronavirus. Will that vaccine help this virus?
It's an interesting question that you asked right there. Just because one antiviral works on one particular aspect of it doesn't necessarily mean it will work on the next one. As you saw in the previous slides, they're testing flu viruses for the coronavirus. So we're testing, the flu antivirals for the coronavirus. They're also testing HIV antivirals for the coronavirus. So the previous one, where you have the SARS coronavirus, can it affect and can it impact the COVID? Answer is, we really don't know, and I would be very careful of hopping on social media and as I was telling the patient, take everything with a grain of salt, even the grain of salt, because you are not sure exactly how that information came together to be put together there. And quite frankly, we have to do the appropriate clinical trials through the FDA and through the CDC prior to actually sitting there saying, yes, this will work, let's start doing that. These things don't happen quickly. That's why it's so important that when we sit there and say prevention is the best medicine. We're all looking towards how do you treat, how do you fix. How about we don't get it in the first place by doing the right things? Let's focus on those kind of things first. Those are simple, those are cheap, those don't end up causing you to be living in the ICU. That's the best way to go about doing it. Now, that being said, if you do get it or a family member gets it, you need to have some real serious discussions with the family member, especially if they have multiple diseases, especially if they're immunocompromised, because their chance of making it through may not be very good. So the family needs to come together and talk about what the long-term plan is with that. So, good segue. How can I help my family and community? Well, this is an interesting picture that I put up here. Why? Because this is in New York. It's hitting all the social media sites. I think it was on Instagram when I first saw it. It's a guy on the left-hand side with a flower, and he's actually walking in a bubble. And he's with a girl that's on the other side that's not walking in a bubble. So the story behind this is that he was lonely, and he noticed a girl across the way in New York, and they started calling and talking to each other from a distance. And so what did he do? He bought a bubble, put himself in a bubble to go meet her. He met her and went on a date with her inside a bubble carrying flowers, and that's how they do their thing. You don't need to live like this. That's what I'm trying to tell you. You don't need to go to such extremes to protect yourself and your family. Very simple things on this slide here. What do you need to do? Avoid close contact with people who are sick. Okay? If they're sick, 6 feet away, make sure only one person takes care of them, and that person, monitor that person that's taking care of that other individual. Cover your cough or sneeze with a tissue, then throw that tissue in the trash. Okay? Don't let it sit around on the tabletop, don't let it sit on the ground and somebody else pick it up. because that could be a source of infection there too. Put in the trash, seal it up, have a separate trash can. What I would suggest, have a separate trash can just for those kind of things. And when you're managing the trash can, wear gloves. Throw the gloves away when you're done with the trash can and wash your hands. Wash your hands, wash your hands. Clean and disinfect frequently touched objects and surfaces. Please be careful when you do this. I've taken care of a person many years ago in the ER when they bleached so much their bathroom that they gassed themselves from the bleach. Make sure that there's plenty of ventilation when you're using bleach products, okay? Chlorine products as well too. Please make sure there's plenty of ventilation for that to happen. If you're sick, stay home. Unless you have to go get some medical care. Wash your hands, wash your hands, wash your hands with soap. Please do not put hydrogen peroxide directly to the skin. It is very caustic to your skin. Dilute it, 50% water, 50% hydrogen peroxide if you need to. Do not ever, ever, ever do that. Putting direct hydrogen peroxide on your skin is not good. And it's hard for me to take it, and I'm sure the viewers are watching me touch my mask multiple times. Avoid touching your nose, your eyes, and your mouth. Okay, so this is a really good slide here from the Pan American Health Organization. So, this addresses the fact that there's a lot of elderly folks that are living by themselves. How do you take care of them? Or even the elderly folks that you have living with you. Check on them frequently. Call them up. Text them. If they don't know how to text, teach them. Okay? Contact them often. At the Dedicated Senior Medical Center, we do what's called love calls. Okay? What is that? We contact patients every single week just to check on them. Are you having a cough? Are you having a fever? Do you have all your medical supplies? Do you have all your medications? Do you need food? Do you need toiletry? If they don't have these things, we actually go out and buy these things and deliver it to their homes. Because the last thing that we want for our patients who are in this prime category is for them to go on safari hunts looking for toilet paper. Right? That's very dangerous for them. So we want to make sure that they're healthy, happy, and at home. If you visit them, maintain a distance of at least 6 feet to avoid physical contact, handshakes, and hugs. Back at home, my brother-in-law, when they visit the parents are by themselves, they take care of themselves. My brother-in-law goes to the house, drops off food outside, knocks on the door. Before they show up, they let them know, hey, I'm coming over to bring up groceries. He drops off the food and takes off. Grandparents go out, get the food, clean up the food, and then they have their breakfast, lunch, dinner in that manner. Try to do things like that. Look after your neighbors that are elderly, okay? Loneliness will lead to depression. When you're depressed, what happens? You stop taking your medications, you stop eating, you wither away. Don't let your family members, don't let your neighbors do that. Care for them, okay? What else can you do? Talk about buying grocery supplies and medications for them. Make sure they have at least a month's stock of regular medicines, okay? If they can't get the medication, ask them, can I go pick it up for you? Or can the pharmacies deliver it to their house? What we do at Dedicated is we try to make sure that all our folks get their medications. If not, we dispense them and they deliver it through FedEx by the afternoon, evening time. Okay? What else do you need to do? Help connect them with their doctors. Talk to them. When's the last time you seen your doctor? You got a temperature? Let's call your doctor. A lot of doctors are doing televisits. We do the televisit too. A lot of my patients have my cell phone number. They can call, text, FaceTime me, or even WhatsApp me anytime that they want. And we encourage that. And encourage you to do that as well too. You know, the closer you are with your primary care doctor, the lower the likelihood of you ending up in the ICU or in the hospital, period. So have that relationship, grow that relationship, build that relationship too. What else can you do? Remind them to wash their hands. Even when you're sick, wash your hands. Make plans in case they fall ill. Well, one of the biggest things for a lot of folks is they have a cat or a dog. Right? So they're unwilling to go to places to get themselves healthier because they're worried about their cat or dog. Help cat sit or dog sit for them, or at least keep an eye on them. Put the cat or dog in the crate and keep an eye on them. That way they don't have to worry about that. They can worry about their health. If they need to go to places, take them if you need them. If they need to go places, call Uber, call Lyft. For our folks, we bring them in through Uber and Lyft and whatnot. So that way they don't have to, try to drive either. Encourage to maintain a healthy lifestyle. Keep eating nutritious food. This is not the time to sit around and eat popcorn and pizza and watch Netflix and then engorge yourself into a hyperglycemic state or to a heart attack. Heart attacks and strokes still occur very often during COVID season time too, right? So yes, it could be COVID, but can you still get a heart attack, stroke? Yes, you can. Can you still get appendicitis? Yes. Can you still get gallbladder disease? Yes. Can you get cancer? Yes. Still live healthy as you're going through all these things here. Some of the things that I encourage a lot of my patients to do is, exercise. I'm sure you guys have seen the video of the gentleman, I think it was overseas, that literally ran a marathon in his backyard. He went round and round and round in a 15-foot garden and somehow ran 25 miles out of that. I don't suggest everybody do that. Not many people have the patience for that. But you could certainly do things like lunges at home, squats at home, stretching exercises. There's lots of exercises that you could go and do at home. There's lots of things you could pull up on YouTube and watch how to exercise at home. Utilize those things to do that. And a couple last things. Make sure if you can't see them, the individual that's sick or the elderly individual that you're living next to, put WhatsApp on there, do FaceTime, but communicate with them. That's really, really important to prevent loneliness. And last but not least, be kind, show empathy, talk and listen. Help them cope with stress. Sometimes folks don't want to hear you talk. They just want you to sit and listen. Sit and listen. Because there are times when all of us just need to get it out instead of keep it inside. We're in the church of God here, right? Pray with them. Prayer is good. Prayer doesn't hurt anybody. Sometimes you need prayer to get you through some of the roughest points in your life. Okay, be empathetic, those things. Questions?
What is the rule of 10 as it relates to social distancing and also our shoe covers effective?
I heard the rule of 10. I don't have it off the top of my head. I'll have to get back to you on that. But I did hear about that. Shoe covers on your feet. Again, you have covers on your feet and you collect those things. You're going to have to take those shoe covers off at some point in time. Right? So anything that you touch can be contaminated. You take off the shoe cover, what's going to happen? You touch that shoe cover and then you spread it to everything else. Putting on shoe covers all the time, while maybe initially beneficial, you'll find that it gets pretty expensive over a period of time. The best thing to do is really keep the shoes outside in the garage, right? And then when you want to wash it, come back outside with some gloves, wash it. So this ends the presentation right here. I do thank everybody for being here and listening and having the patience to sit and listen to me. It's sometimes difficult for me to hear myself at times, but I do thank each and every one of you. I want you to understand, again, COVID-19 affects the African American population significantly. Significantly. Don't be statistics. Do the simple, easy things really, really well, and you won't be part of that statistics. Will we still have them? Absolutely, we will absolutely have those individuals. And for those individuals that are going through that you do know, love them, take care of them, pray for them, watch over them. You may have to do it at a distance, but it's okay. Do it nonetheless. It's not necessarily always the act that counts. It's a thought that counts, and I think everybody benefits from a prayer. Thank you very much.
Good evening, folks. I won't take nearly as long as Dr. Kumar here. There's not much else to say after him, but I'm just going to take about maybe 5 minutes at the most to just give you a quick overview of who we are as Dedicated Senior Medical Center. Hence the name, Dedicated Senior Medical Center. We are dedicated to helping seniors. So there are a couple of first primary things to be involved with us. You have to be a senior. We only take care of people 55 and over. So you have to be 55 or over. You have to be on Medicare and one of the Medicare Advantage insurance plans that we accept, which are about 9 different ones we take. But those are, to even be part of us, those would be the first things that are required. Now, we know everybody is at 55, but even if you're not, you may have a mom, a grandma, aunt or uncle, neighbor, friend that we talked about that is. So tell them about us if you think you liked anything you hear tonight. So quickly, things are different about it. First and foremost, we are a doctor's office. We're a family primary care doctor's office. But we are staffed with the knowledgeable, empathy, passionate kind of doctors like Dr. Kumar you heard tonight. So we only hire those kind of doctors. So we give very special care to seniors only. What's different about us? Number one, you mentioned we get you the doctor. So we provide door-to-door transportation for all of our patients. We pick you up, we bring you, we take you home for no cost every single visit. Besides having your primary care doctor there in the same building, we're kind of a one-stop shop. We have your primary care doctor, and we have board-certified MDs only. We don't pawn you off on a physician's assistant or somebody. You will see your MD every visit, not once a year, and then the rest of the time you see some assistant. If you're Dr. Kumar's patient, you're going to see Dr. Kumar every time you come in there. On top of that, in the same building, we have a cardiologist on staff. We have a podiatrist on staff. We have an acupuncturist. Most Medicare plans don't cover acupuncture, but we provide it at no cost because our doctors really believe in the healing of it. Anything to not do pain medications, if at all possible, we use acupuncture, so that's there at no cost. We also have a behavioral health specialist and a social worker on site to help people with counseling, foods. We have people all the time end up without a place to live. We even help them with things like that through our social worker. So we have all of that. Then all of your diagnostic testing. We do all of your blood work on site. We do standard x-rays on site, echocardiograms, ultrasounds, nuclear stress testing. All these things we do in our building in the same place. We also have a medication dispensary on site. If you want to get your 200 of the most common generics, you can get right on site. We have a Tai Chi room. We have Tai Chi classes every week, exercises. We have healthy eating, diabetic education classes in there, parties, all kinds of things like that. So basically, it's a wonderful place to get great health care for seniors. We know some people, if you feel like the best health care you can ever get, you're already getting right now, God bless you, we're happy for you, and continue getting that. But we know we run into people all the time that are not getting as good a care as they probably deserve or could get. And we just want people to know that we're there for those people. So I want to leave you tonight. The last little thing here, I'm going to, a quick little thing that we send around to people. So have the right doctor. Do you have the right doctor for you? So ask yourself these questions. Is your doctor's office still open right now through this? Many doctor's offices have closed. We are still open, as Dr. Kumar mentioned. We're doing as much as possible telehealth, televideo visits with your doctor, because we don't want to bring you out and expose you to this thing if we don't have to. But we are still open and seeing people in our building, in our office, if it's people that need to be. The sickest, the people that have severe things that need to really see the doctor in person, we are still there and still bringing them in to see them in person. So is your doctor's office still open doing that? Have you heard from your doctor within the last 2 weeks, as Dr. Kumar mentioned? We reach out to all of our people almost at least once a week. And we see some of them in person up to once a week or more often if they really need it. So we stay very much in touch with our people because, again, that's the only way we can catch these kinds of things and prevent them before they happen. Most of the time we would prefer that. So we're very much about preventative care. Is your doctor personally calling you and texting you to check on you? I said, our doctors call and talk to our people regularly. Every 1 to 2 weeks, they personally call them. Many of them, like Dr. Kumar, give their personal phone numbers to you to call 24 hours a day, 7 days a week. You can personally call him. If you need the doctor, you need to talk to him, he's available there to talk to you. Not many doctors do that, I can promise you. Has your doctor called you to explain the risks of coronavirus? Just like this presentation he put on tonight. Obviously, he doesn't take that long with every single person, but our doctors call everybody and give them the basics of what to look for. Do you have a fever? Do you have the cough? Or, these things. They're checking on them constantly about these symptoms to see. And if there is any risk at all, we're going to send them into the hospital if we think that's necessary, or get tested, take whatever steps are necessary. Is your doctor's office offering the doctor phone visits? Like I said, some places are, but some may not be. So some places, we've run into people that really haven't talked to their doctor for months. They're running out of medicines. They can't get their scripts filled because they can't find their doctor. Those are the kind of people that we want them to know we're here for them. We can help them if they need it. Does your doctor's office allow walk-in visits? You can walk in anytime to our place and the doctor will work you in and see you. Are you able to call your doctor day or night? We talked about that. All of our doctors, even if you don't have their personal phone number, we have a call service. You can call 24 hours a day, 7 days a week, and you will get to talk to a doctor of ours. Getting trouble to and from the doctor, like we mentioned, we solve that with the transportation that we provide for you. Is your doctor helping you make sure you're receiving all your prescriptions? Like I said, through this, many people are having problems keeping their prescriptions filled. So we make sure they have them and we deliver them to them. We don't want them going out to get them. Like you mentioned, even food, toiletries, medicines, we're going to get that stuff to them. So basically, that's really all I have. We just want to let people know we're here for the community, for the seniors, anything anybody needs. Like you said, food, medicine, housing, transportation, anything, we're here to help. And once this thing's over, we'll get back in touch with the church here too. We come out and do services, we sponsor things. We'd love to get more involved with your church here and provide luncheons, have bingos, have parties. We come out and do senior trivias and all kinds of things like that. So we just bless all of you. We want you all to stay healthy. And anything anybody needs, I left a few of my cards here and some of these flyers of who we are and what we do. So anybody can get a hold of somebody here at the church, and some of that information's here if they need any more information. So again, we thank you very much for allowing us to come in here and do this, and God bless all of you, and we wish you all the best.
Okay, we'd like to thank Dr. Kumar Landstrom, as well as the dedicated Senior Medical Center, for allowing them to come out and do this tonight. For those that may want the PowerPoint slide, we're going to make it available. We'll post a link on Facebook. If that doesn't work, you can send the church a message through Facebook or call up here and we'll leave us your email address. We'll make sure you get this copy of this PowerPoint slide. We thank you all for joining us. At this time, I'd like to call up Brother Mitchell to close us out in prayer.
Father God, we thank you for this night, and we thank you for your service to come out and to show us the Bible. So things we need to be educated upon about the coronavirus. Father, we protect them and keep them from all the harm and danger, Father. Shield them in your blood, Heavenly Father. Cover us in your blood, Father. We just thank you for this night, for loving us, for keeping us, Brother Tucker, having the foresight and the brothering to have these men come out, Father. We you say in your word that you work your earthen vessels, so we're going to obey the orders, Heavenly Father, do everything we can to keep on keeping on, Heavenly Father, and when it's all said and done, you receive all honor, glory, and praise. In Jesus' name we pray. Amen.